9 early warning signs of dementia. Dementia is a broad term that refers to various symptoms affecting a person's cognitive functioning severe enough to interfere with daily life. Although it's more common in older people, it's not just a natural part of aging. Dementia can affect people of all ages. Also, there are many different types of dementia, and they can affect different parts of the brain. It is a progressive condition that worsens over time. And while symptoms can vary due to the underlying causes, there are some things to look out for. Whether you're concerned about yourself or someone else developing dementia, it's important to familiarize yourself with the common warning signs of this condition. Number 1. Memory loss that affects day-to-day abilities. Every day, we rely on our memory to remember things, like what we did yesterday, where we parked the car, and how much money is in our checking account. But what happens when you can't remember those things? Memory loss can be a sign of an underlying problem that's affecting your day-to-day abilities. In fact, it's one of the earliest signs of dementia. Completing tasks that require short-term memory, such as writing down your grocery list or remembering if you turned off the stove, can become difficult. Many people with early memory loss will also forget names, dates, and events. Number 2. Difficulty performing familiar tasks. If you're noticing that it's getting harder to do things you've done many times before, like driving or paying bills, it could be a red flag. You may also have trouble performing seemingly mindless tasks, such as making a cup of coffee or doing the laundry. While this kind of problem might seem like a normal part of aging, it can be an early warning sign that something more serious is happening in your brain. Number 3. Problems with language. Language is one of the most important ways we communicate with each other, whether it's speaking or writing. But it also includes understanding what people say and expressing yourself clearly when talking to others. Unfortunately, language is one of the first things to be affected when you have dementia. This can manifest in many ways, from difficulty following conversations to forgetting how to use certain words, trouble finishing sentences, or getting stuck on a single word or phrase during a conversation. You may also struggle to comprehend what other people are saying without any clear reason for why it's happening. Number 4. Disorientation to time and place. If you've been experiencing confusion about where you are, how you got there, or what time it is, this could be an early warning sign that something isn't quite right with your brain. You may feel as if you are in a different time or place than the one you are actually in. It's not necessarily something to be concerned about if it happens once in a blue moon, but it should be addressed if it becomes a regular occurrence. Although disorientation to time and place can be caused by other conditions, it is one of the early signs of dementia. Number 5. Impaired judgment. If you're suddenly struggling to make decisions or form opinions, it could be a sign that something more serious is going on. In the early stages of dementia, you may notice that your judgment is impaired. We can define impaired judgment as a loss of ability to make good decisions, gather information, and use it effectively. But it's not about making bad choices. It's about being unable to make any choices. This can significantly impact daily life, as it can lead to problems, like the inability to manage money, make important decisions about your health, or take care of yourself. Number 6. Misplacing things. Do you find yourself putting things in places where they shouldn't be, like keys in the sugar bowl or your wallet in the fridge? It's not uncommon to misplace things from time to time. However, it becomes a problem when you forget where specific items are kept in your home and have trouble finding your belongings. If you misplace things more often than not, and it's interfering with your daily life, it may be a warning sign of dementia. Number 7. Problems with abstract thinking. Abstract thinking is the ability to think about things that aren't physically present. It is a skill we all use daily to understand the world around us and interpret our thoughts and feelings. We plan for the future, consider hypothetical scenarios, and imagine how things could be different. As we age, our brains naturally lose some of their ability to process abstract ideas. This isn't necessarily a cause for concern. It just means that as we get older, we sometimes have trouble coming up with creative solutions or seeing truths beyond what's right in front of us. That being said, losing your ability to have abstract thoughts is also a sign that you are developing some form of cognitive impairment. If you're having trouble understanding what's going on in your life or why things are happening, it could be an early warning sign of dementia. Number 8. Challenges in understanding visual information. Do you find yourself having trouble reading labels or following signs on the street? Do you have a hard time telling colors apart or remembering faces? Having difficulties processing and understanding visual information is one of the early signs of cognitive decline, so it's important to keep an eye out for it. Not only does it affect your ability to comprehend what you see, but it also makes it difficult to tell when someone else is trying to communicate with you through their visual cues. Number 9. Changes in mood and personality. Changes in mood and personality are not always obvious, but they may be more noticeable if you're paying close attention. You may notice that you're becoming more irritable or easily agitated. You might have trouble controlling your emotions or become more withdrawn or isolated. Changes in mood and personality are common early signs of dementia. However, they can also be caused by other mental health conditions, such as depression or anxiety. So it's important to rule out all other possibilities before jumping to conclusions. Dementia is a complicated condition, and there is no single cause. However, certain factors can increase your risk of developing it. These include age, genetics, and brain injury. Other factors include vascular issues, vitamin deficiencies, and poor lifestyle choices, such as excessive drinking and smoking. And while there is no cure for dementia, early diagnosis and treatments are vital because they can help slow the progression of symptoms. Thanks for watching. If you thought this video offered some useful information, give it a like and share it with your friends. It allows us to create more great content. If you want to see more videos from us, hit the subscribe button and turn on notifications so you never miss a video.